I heard a quote the other day, you can't be what you can't see.
Because of where I grew up, I didn't see anyone in positions of power who looked like me. And it really shaped the way I saw myself in the world.
I went to an all-girls school from the age of 4 to 18, and I think that having been there in an all-girls setting for so long, I think when I thought about success and leadership and like who are my role models, it was always women. Like that's how I came to see the world. Probably because I had this lens of the world that was a little bit skewed from a young age because I thought all the leaders were women.
I remember when I think I was in second year med school, I read this paper that came out in JAMA, and it was like in 2016 saying there's this sex difference in physician salaries in US medical schools, and the amount was like $20,000. I thought, why is there this difference in salary between men and women when we're doing the same job? Like it just didn't make any sense to me.
Ends up being a lot of an excuse of saying, like, honestly, you just have to wait your time. Like, eventually this will come, but it's not, like, that's why it's happening. And people kind of, I think, often use that as an excuse of saying, it will eventually happen that we'll have enough women to be able to choose them for leadership positions. But right now, it's not the case. And I feel like that's shortchanging a whole gender quite a bit.
I introduced myself as Dr. Wang. And like, that's something that I've recently started doing because I initially started residency being like, hey, I'm Grace. I'm one of the resident doctors looking after you. And people would like just inevitably forget. Like I would go through the whole CTU day and we would get complaints from the patients that they hadn't been seen by a doctor all day. And then it'd be like, oh yeah, but Grace saw me. Like these little experiences really just, I think on the day-to-day, you don't realize, but over time they accumulate and make for a less inclusive environment.
The more excluded you are and the more on the margins of the dominant type in a society, the more cultural knowledge you have because you understand the dominant culture, but you also understand your own, whereas the reverse does not happen. And so I think to have this group of all of us as women, we have that quote unquote privilege of understanding.
There's all these small microaggressions that are still very much alive and real. And I think like can't be underappreciated in the context of, even women having leadership roles. There's still so many things that are happening on a smaller level with our own trainees. We're trying to prevent that from happening to other people. And so it's nice when people in leadership positions really are doing that for you.
All of my junior residents, I introduce them to patients as doctor because I find that like by introducing a female junior resident as by their first name, that oftentimes, even if I say they're like a resident on the team or a resident doctor, unless I explicitly say their name is Dr. Blank, oftentimes they'll be assumed that they were the nurse, or the patient will never think that they were actually seen by the doctor. So I think that like there are certain little things that we can do to be a bit proactive.
Personally, for me, the chief that I worked with the most when I was in R1 was also a woman. And so seeing as well, like a chief in the position that I potentially wanted to do was really, I think, exciting and probably opened it up a lot more to me, maybe without even realizing.
It really took me seeing a female senior resident that I had or female staff that I had to say, hey, like I could do this. This could be a place where I belong. I think that for women, it is so important to see representation. It is so important to have that sense of belonging so that women can start to feel that it's not an anomaly. It's not an exception for them to be taking those paths of leadership or, and so, like for me, it was really, really important.
It was amazing to see that transition and seeing more women in positions of power. And I think for two main reasons. One, to know that it was possible. And two, to know that they were people I could go to with shared experience. We can validate each other. We can empathize with each other. And there's power in numbers in that respect.
It's the first time in history that U of T has had an all-female cohort of CMRs, which in and of itself is pretty amazing. And I can bet you that there was a time where there were many cohorts of all male CMRs. So that in and of itself is pretty amazing and just something to be proud of.
It's really special to be a part of this narrative and hopefully increase the number of women and expand the female representation in academic medicine. I just feel really, really proud of us. I think it's just so cool that we're making history this way.
I hope that one day I can be that person for another woman who's wondering if they're good enough, wondering if they have a place, but to give them that sense of belonging.
This is a huge in terms of setting an example for medical students, for residents, and I think for people senior to us too, to feel really optimistic about the future of women in leadership, because this is really big. It's okay for leadership groups to be all women. This is where we're headed. I think it's extremely exciting.
Other women trainees can see us in this position and to see that this is attainable and something they should be going for. If they're interested, and to just have that role model, but it's the fact that it's the first time and it's 2021.